everyone. I'm Eleanor Schano, sitting in for Yvonne. She's still on vacation. And we want to welcome all of you. It's a lovely day here in Pittsburgh. We have a beautiful audience, and we have a fascinating half hour. We're going to hear from our audience a little later as we explore a most fascinating subject this morning. See this stopwatch? Well, it's a pocket watch that is very familiar to anyone who has watched the stage Hypnotist work. You know how it operates. He asks for a volunteer from the audience. The volunteer comes up, he hypnotizes the volunteer, then makes him do strange things, maybe bark like a dog or meow like a cat. This whole system has really frightened an awful lot of people. And that's what we're going to discuss during the next half hour. We're going to try to dispel some of the myths about hypnotism, because hypnotism is a very serious subject today. It's being used to correct some very serious problems such as obesity, drug addiction, and a lot of other serious problems. Now, with me this morning is Dr. Samuel Santoro. Dr. Santoro is a Pittsburgh psychologist. He's on the faculty at the University of Pittsburgh, and he uses hypnotism in his private practice. Welcome, Dr. Santoro.
Thank you.
And my first question is, what exactly is hypnotism, and how is it used today in medical science?
Well, hypnosis is a state of relaxation. It is not a state of total unawareness. Most people think that that's the case. The patient is totally unaware of what's happening, and that they will wake up with no memory of the experience. Of course, this is not the truth. It is an altered state of consciousness, if you will, a super state of a consciousness, a super acuity of the mind. And it's used in a variety of purposes, the control of weight, drug addiction, alcoholism, and psychotherapeutic practice, as many forms and shapes, and as the creative therapist can put it too.
Okay, what really happens when one is hypnotized?
What happens is the person goes into a very deep state of relaxation, physiologically likened to a night sleep. Body is totally relaxed, but the mind remains alert and awake and super efficient.
Do you feel any physical or psychological change come over you?
Yes, there is physical change. The physical change is one of relaxation. Again, like being in a night's sleep. The heart rate slows down, respiration becomes shallow, pulse rate slows, and it's a magnificent state of peace and relaxation.
How much control does the hypnotist have over the subject?
Absolutely none. The other mythology about it is that the therapist controls a person's mind, and of course nothing can be further from the truth. You can't cause anyone to do anything in hypnosis that they would not do in a non-hypnotic state.
It's a very important point, because I think this is why a lot of people are frightened by hypnosis. They think that the hypnotist has total control and can make them do very strange things, very weird, very frightening things. You say this is not true.
No, it's not. If a person is going to do weird things, he'll do weird things without the hypnosis.
Can anyone be hypnotized?
Pretty much most people can if they give you enough time. There are some subjects which are indeed harder to work with, but pretty much almost anyone can be if they give you time.
All right, can a subject be hypnotized without them knowing that they're being hypnotized?
Yes, there are techniques that one could use in hypnosis, giving hypnotic suggestion. The leading hypnotherapist, Dr. Milton Erickson, describes this technique. It's called an interspersal technique. In conversation, the hypnotherapist suggests things while in conversation, and they don't get at the conscious level, but unconsciously the unconscious mind picks it up and the person does what's suggested. But again, here the patient would never do anything that he would not do. So essentially he's doing what he wants to do anyway.
I know you've had great success in treating patients who want to stop smoking, who want to lose weight, who have other psychosomatic type illnesses. These people, I would assume, have to want to correct their problem. You can't help them unless they want to help themselves, am I right?
That's correct. The patient has to want it, and pretty much I've had such success because the people who come to me, of course, are highly motivated, especially the control of intractable and severe pain. The motivation for that is quite high, and patients in this condition are quite easy to work with. They really don't want the pain anymore.
We're going to take a short break. We're talking with Dr. Samuel Santoro, psychologist who uses hypnosis in his private practice. We'll be back in just a minute. Stay with us. Well, welcome back. We're talking this morning with Dr. Samuel Santoro, a local psychologist who uses hypnosis in his private practice. And even just in the first few minutes of the show, I think Dr. Santoro has done a great deal to dispel some of the myths about hypnosis. And it is not, it's just not hocus pocus. It's very serious business today. But I have heard of certain people who have been hypnotized by the so-called stage hypnotist who, after the experience, go into a state of depression. Why is that?
Well, sometimes this is possible, mainly because some people have minimal coping ability, and going into deep levels of relaxation can cause psychological abreaction and profound psychological damage. It's a very serious tool and should be only in the hands of licensed and competently trained clinicians.
Are there some people who should not be hypnotized?
Yes, there are. And such people who are easily diagnosed by a trained clinician. And often a trained clinician will not do hypnosis with certain types of personalities. This is why it is absolutely crucial that a total medical and psychological history be taken before hypnosis is attempted.
Dr. Santoro, we have a member of our audience who has a question for you. What's your name?
Rita Wehagen.
Rita, you want to ask Dr. Santoro something?
Yes. Is there any possible danger in becoming hypnotized?
No, not at all. Not in the hands of a competent, licensed professional. The professional would never attempt hypnosis if he felt or she felt any danger could come to the patient.
Okay, we have another question. What is your name?
Marlene Sistek. Have you ever hypnotized anyone in order to regress them to a former life?
Yes, I have.
Do you do this by handwriting?
No, we do it by voice, and that gets into reincarnation. And, I've done this and clinically have experienced this with people, yes.
Thank you.
Yes, another question. What is your name?
Andrea Kelly. Can hypnosis change a person's personality, like?
Yes, in that if you remove a problem from the person, they're freed from this problem, and as such, every aspect of their life changes. It becomes fuller and richer and more successful. In that way, it can. But it can't add IQ points. If you're a fool and you go into hypnosis, you'll be a fool coming out.
Okay, Dr. Santoro, I know that the Pittsburgh Police Department is considering, as a matter of fact, they are now in the process of training several of their detectives to use hypnosis in interrogating witnesses. You have already voiced some strong opposition to the idea. Why?
Well, in general, I'm against such things because, again, it places the tool in hands of non-professionals. In this city, however, the experiment at the moment is being controlled by two eminent hypnotherapists, Dr. Scott and Dr. Thompson. And If it would be successful any place, I think it would be here because of the stature of both of these people.
Okay, now the way this would work, as I understand it, is the detective, the police officer, would, in interrogating a witness, actually try to help them recall certain incidents that maybe they wouldn't remember otherwise involving a crime. Could this have any kind of devastating effect on the witness? For example, maybe one wanted to suppress witnessing a certain event. What happens to this person when they leave the interrogating room?
Well, of course, it can create profound psychologic damage, and which is, of course, why the experiment would have to be totally controlled by persons who are competent at the skill.
Okay, Dr. Santoro, we have a phone call. Good morning. You're on the air with Dr. Santoro.
Hi, I'd like to know, my daughter is 10 years old and she's still a bedwetter, and she's been checked for anything physical, and there's nothing there. It's her sleep pattern. She sleeps very deeply. Would hypnosis be able to correct this, and also is she too young to be hypnotized for this?
First of all, it's imperative that in any such symptom that the person contact their treating physician. The treating physician is always in charge of the total health program of the person. Now, if he has assured her that it's not physical and he's taken the appropriate diagnostic procedures, he may advise that there might be some psychological problem. In this case, the answer is, of course, hypnosis could be efficient, and children are the best learners of hypnosis. I teach hypnosis to children in less than 5 minutes.
What is the youngest age?
Well, I taught my son hypnosis when he was 5, and I did that in 2 minutes.
We have to take time out for another break. We'll be back with Dr. Sam Santoro, psychologist, and we'll continue our discussion, fascinating discussion on hypnosis. Welcome back. We've been talking with Dr. Samuel Santoro this morning, who has done a fine job of dispelling any fears and explaining away any myths about hypnosis. I think he has also convinced a lot of us that hypnosis can be indeed effective in correcting some severe medical problems. But you know, as they say, the proof is in the eating. So we have with us now one of Dr. Santoro's patients. Her name is Marilyn Ellis. And Marilyn, would you believe it or not, lost 65 pounds through hypnosis. Marilyn, did you have any fears about going into hypnosis to lose weight?
Yes, on my first visit I was very hesitant, but he talked to me for about a half an hour and I was fine.
Had you tried anything else? Had you really tried to lose weight?
I've been on diets all my life, never worked.
Okay. What does it feel like to go into a trance?
Very relaxed. My body is totally numb, and it's like traveling in a tunnel sometimes.
Now, you were able to hypnotize yourself, which is what Dr. Santoro
Yes, he taught me
taught you to do.
self-hypnosis.
Okay. After you left his office on that first visit, did you feel any different than you had felt in the past?
No, exactly the same.
Okay, well, when did you realize that the hypnosis was working?
Well, the next morning when I got up, I started to brush my teeth for work, and I gagged on a toothpaste. So then I ran into the kitchen to get a glass of milk, and the smell just went like that because he took milk away from me also. So then I knew.
All right. In other words, in hypnotizing you, Dr. Santoro, through the power of suggestion, told you that you would not like certain foods that you knew were creating a problem for you. Do you still crave any of those fattening foods?
Not really. Not really.
Now, do you hypnotize yourself every day?
For 5 months, I never missed a day. Now, I use hypnosis about twice a week.
How long did it take you to
times a
lose
week.
65 pounds?
About 5 months.
Okay, Dr. Santoro, your patient, share with our audience exactly what you did in treating Marilyn, if you will. I mean, how did you go about putting her into a trance? How did you go about suggesting to her that she would no longer be interested in the kind of foods that had caused her to be 65 pounds overweight?
Well, the technique I used with her is called an Fixation progressive relaxation technique. It's essentially causing someone to stare at a particular object, and they eventually close their eyes, and you literally talk their body to sleep, and then deepen that relaxation and sleep until you can create hypnotic phenomena. In Marilyn's case, we sent her into her stomach, and then we created aversive conditioned responses. For instance, in the milk, it would be most unpleasant. It would have a terrible odor and taste, and it would be most unpleasant. Essentially, you change cognitive maps. You don't change the conscious, you change the unconscious motivation for it. And unconsciously, it becomes unpleasant. As it becomes unpleasant, of course, it's unwanted.
I think we should also point out, because this is quite a serious illness, and we've been reading a great deal about it lately, the disease of anorexia nervosa, which is the disease that, well, people are so turned off, they cannot eat, therefore they lose weight, and in many instances this is fatal. You are able to treat people for this disease also.
Yes, I am presently treating 2 young ladies for this, but again, they have had competent medical supervision and remain on such. We've reversed this trend, and they're both putting on weight.
Okay, you have to, doctor, again, and we've discussed this earlier, you have to want to correct the problem. I remember a few months back a stage hypnotist came to town, and we did a television report for the 6 o'clock news, and he was going to hypnotize a large group of us so that we would not smoke. Well, it worked for exactly 1 day and a half in my case. Now, a lot of people said, well, what happened? I mean, you know, the hypnotist, he wasn't any good. I said, no, that's not true. I didn't want to stop smoking badly enough. So therefore, I would have to assume that one has to want to correct these problems.
Yes, that's exactly right.
And in Marilyn's case, you say you had tried everything else. You have lost this weight. You have, what, a size 7 figure now. Do you feel so comfortable with how this was achieved that you don't concern yourself about ever gaining the weight again?
I feel that I'm conscious of it all the time, and I feel that I have to go back to my hypnosis or I might have problems.
How often did you go to Dr. Santoro during this treatment period?
About 6 weeks.
I mean, what, once a week?
Once a week.
Now, do you go back for a little checkup occasionally?
Yes, once in a while.
We're going to take another break. We're talking with Dr. Samuel Santoro, and we'll continue our discussion on hypnosis in just a minute. Stay with us, won't you? Welcome back. We're talking with Dr. Samuel Santoro, a psychologist, about hypnosis, and we have a phone call from one of our viewers. Good morning. You're on the air.
Hello. I would like to know if hypnosis can be effective in helping a person get out of a depression.
In helping a person get out of depression, can hypnosis be effective in that area?
Yes, it definitely can, but again, it has to be used by a skilled clinician in a comprehensive treatment program. The hypnosis itself won't affect cure of the depression. It can eliminate a great deal of the physical symptomatology associated with depression, headaches, inability to sleep, etc.
In other words, doctor, where depression is concerned, the psychiatrist would treat depression by trying to get to the source of the problem that caused the depression. The psychologist using hypnosis is interested in allowing the patient to elevate himself out of the depression so that he can cope. Am I right?
Yes, essentially the psychologist would use, if he had the tool available to him, hypnosis and the traditional forms of psychotherapeutic intervention. But hypnosis alone would not eliminate the symptomatology of depression.
Okay. We have another phone call. Good morning. You're on the air with Dr. Santoro.
Good morning. Does the hypnosis work for a student's test?
For a student, I'm sorry, can you repeat the question?
Does hypnosis work if for a student's test, this person forgets everything, can't remember one thing, gets nervous?
I think the question is, will hypnosis work for a student to, what, pass a test?
Yes.
Oh, I see. In other words, okay, that's a good question.
Yes, the answer to that is yes. I've helped some people study for the law boards and medical boards, and they do their reading in trance, and when they do their reading in trance, they can read at greater rate and dramatically increase retention of what they read, because they're essentially blocking off all extraneous stimuli, so it can indeed help.
Okay, we talked a little earlier about the method you used in hypnotizing Marilyn so that she was able to lose 65 pounds. Demonstrate, if you will. But before Dr. Santoro demonstrates hypnosis, I think it's important to mention that this is something that no one should practice on their own without some sort of supervision. Am I right?
Oh, absolutely. It must be taught by a licensed and competently trained person.
Show us what you did.
Actually, all hypnosis essentially is a phenomenon of self-hypnosis. No one ever hypnotizes someone else. We simply teach hypnosis to the person. And from the very first session, the patients I work with know this. They know that I am not hypnotizing them. They are hypnotizing themselves, and I merely teach them how to do that. And by the third session, Marilyn was totally on her own doing the hypnosis. It's such a simple thing. Now, Marilyn simply can put herself into trance simply by making a fist with her left hand, or with her permission, I could put her into trance simply by touching her left shoulder. Either
All right,
way.
which would you prefer demonstrating right now? Would you want to put her into a trance, or Marilyn, would you prefer going into a trance on your own?
I prefer going on my own.
Okay, all right, fine. I would like to see, and I'd like you to show us how easy it is to put yourself into a trance. And by the way, we have a live audience this morning, so this is not a quiet room. We have people staring at Marilyn. Can you do it under these circumstances?
Yes.
Okay, will you please?
Okay.
All right, if it is not distracting, Marilyn, could you describe for our viewers what she is doing right now?
We had given Marilyn post-hypnotic suggestions that when she cared to, she could place herself in deep hypnotic state by making a fist with the left hand.
She is making a very tight fist. As a matter of fact, her knuckles are white.
Yeah. The second fist, the first fist puts her into relaxation. The second fist causes very deep relaxation. You notice breathing is shallow, pulse rate is slow, but Marilyn can hear everything we say to her now. but she's really shut down all of the systems. With her left hand now, if she wanted to, she could achieve a phenomenon known as hypnoanesthesia, that is using that hand for the total control and remission of any pain in any part of her body.
Doctor, we're running out of time. Could we have Marilyn come out of the trance now while I thank both of you? I want to thank Dr. Samuel Santoro, local psychologist who uses hypnosis in his private practice. Thank you, Marilyn. Tomorrow, Bob Kudzma and Pat Boone. So tune in then. I'm Eleanor Schano. Thank you for joining us this morning. Have a good day.